Welcome to All Day, Everyday Preparedness. Today I have a topic that might just make you think twice before taking another bite of your favorite guilty pleasure. We're talking about junk food and those sneaky chemicals hiding in our meals. In our fast-paced lives, it's easy to fall into the trap of convenient, quick meals that not only satisfy our taste buds, but also harm our health in the long run. Did you know that many of these foods are loaded with additives, preservatives, artificial flavors, and chemicals that can wreak havoc on our bodies? But here's the kicker. Some of the ingredients used in the United States are actually banned in other countries. It's mind-boggling, isn't it? So let's dive into the nitty-gritty and discover why America's pantries contain ingredients that other nations won't touch. And let's hear directly from a doctor about how the diseases of our time are caused directly from what we eat. Check it out.
There is a direct correlation between what we eat and the diseases of our time. So all month long, we're focusing on this topic with our health insider, Dr. Shad Marvasti. Thanks for joining us this morning.
Thank you.
So let's talk a little bit about the relationship between diet and diseases, because one absolutely leads to another.
Absolutely. And the reality is that we don't really focus on this in conventional medicine, right? We do medications, we do surgery, and nutrition is really kind of an afterthought. Yet there's a great need for it because medications alone aren't going to solve our problems. And there's also a dark side to that, although they're life-saving. 60% of Americans take at least one prescription drug, but it can be up to the fourth leading cause of death, just from the adverse effects of these drugs. So looking at food as medicine is really important when you realize that there's a big link. Research has shown that in the United States and around the world, the leading number one risk factor for premature disease, illness, and preventable death is actually diet.
Hopefully you've seen my video that I did on the McDonald's Big Mac. If you haven't checked that out, I'll link it in the description. So let's talk about those magical preservatives that help keep that Big Mac and our favorite snacks shelf stable for ages. Ingredients like BHA or BHT are commonly used in the United States, but they've been linked to potential health risks, including cancer. But it's not just the preservatives either. It's the artificial flavors and colors too. You'll find vibrant colors in your candies and sodas thanks to dyes like yellow number 5 and red number 40. However, studies have shown that these artificial colors and flavors have behavioral problems in children. Some countries have taken action and prohibited the use of these different dyes. While they still find their way into American diets, as you know, childhood obesity is at an all-time high, and many of our children are dying before the age of 40. Now, I know what you might be thinking. Why are these ingredients allowed in the United States? Well, it's a complex web of factors, including different regulatory systems like the FDA and the USDA, and also aggressive lobbying. You see, they all tie in together. And the big industry, whether that's big pharma or these big food manufacturers, they need us addicted and they need us sick. Now, as consumers, we have the power to make a change. Now, people, as you know, are leaving here and heading to an early grave, all due to what they're eating. And we all know someone that's left here too soon, or we all know someone that's died from diabetes, heart disease, or even cancer. But just think about it for a moment. 50 years ago, you've never heard of this many cases of disease. It's all related to our diet, what we're eating, and what we're consuming. Now, I lost my father at the age of 62 due to complications of diabetes. I lost both grandmothers to diabetes and my grandfather to cancer. Trust me, guys, it's all related to diet. So don't fall into the trap and think, oh, it won't happen or it can't happen to me. All of these chemicals that they're putting into our food, they build up within the body and within our tissues. And over time, these chemicals start affecting our body. And that's when the disease really starts to kick off. And now these diseases are becoming more and more aggressive. They're even attacking, again, our young children. Now, I created a 30-day plan that helped me lose weight, keeps all of my blood work within normal levels, and it helps relieve any aches and pains. Now, this 30-day program is available as an ebook directly on Amazon. And I follow this eating plan strictly every day. And if you can do it for 30 days, guys, it can change your life as well. Make sure that you're reading labels. You want to become a savvy shopper when you're out there checking those grocery aisles. You want to check those ingredient lists, guys. Familiarize yourself with the harmful additives and chemicals and preservatives, and be cautious about what you're bringing into your kitchen, not only for yourself, but if you have young children as well. Remember, guys, eating clean doesn't mean sacrificing taste. You can explore new recipes, you can experiment with different flavors, and discover the joy of nourishing your body the right way. Remember to like this video, share this video with someone that may be helpful to, and don't forget to subscribe to the channel. Continue to prepare, and as always, be blessed.